cerebral palsy affects every child differently. So they may have a similar diagnosis, such as spastic diplegia, cerebral palsy. Each child may actually look a little bit different because one leg might be more impaired than the other. They may have more balance issues versus another child. It's very specific to each child how their impairments affect them. But overall, it typically affects the way that they activate their muscles. They are unable to have isolated movement on their own. And it makes it, all those fine movements that we take for granted of standing, balancing, and walking all become much more complicated for them to try to attempt to do. Their body doesn't respond as they would like it to do. So they have weakness. They also are dealing with spasticity, which creates limitations in range of motion and flexibility. They have balance impairments, proprioceptive impairments, which is where their body is in space, knowing where their arm is and where their leg is as they're walking and moving and attempting to do different skills. They tend to have decreased sensation sometimes. Their balance is impaired. And overall, just sometimes just even realizing that they're not sitting up straight or not standing up straight. Their perception of where their body is in space is usually impaired. When we work with children with CP, our ultimate goal for them is to be as functional as that they can possibly be and as independent. In order to be able to do those skills and be independent, you have to have the building blocks to be able to do that. So, and that, what those building blocks are getting your range of motion through an acceptable amount, being flexible, being strong, having good balance, having good alignment, and then so that that child then can be able to stand and walk and be independent on their own and as they grow older.
All right, ready, go. Push. All right, Missy. Push.
With children with cerebral palsy need ongoing therapy, typically until they're full grown, because they are always fighting the growth of their skeletal system and the growth of their muscular system that is competing. And their muscles are not staying as flexible and strong as their skeletal system is growing. So they typically have to continue therapy of some sort until they're full grown. We try to progress them into extracurricular activities to supplement some of the therapy as soon as possible. But they do typically need therapy ongoing. So an intensive therapy program is a great way that if a child's able to do it either once or twice a year, that's what we recommend. Usually during the summer, parents like to enroll their children in the intensive program to really give them a good burst of therapy in a short amount of time to help them get to that next skill prior to returning back to school. The whole world of physical therapy is really going towards evidence-based treatment. And a lot of what we're doing in terms of during the intensive therapy program are things that are already proven to work: strengthening, range of motion, endurance, balance activities. The use of the TheraSuit, it does have some research that has been completed. A lot of it is through the Pediatric Fitness Center that has originated the TheraSuit, and there are some smaller clinics that are trying to gather research and data in order to show evidence. But I think it is still in the early stages of proving how effective it is. There are children that the parents want them to do the intensive therapy program, and it's found that they're unable to use the TheraSuit because they do have a hip subluxation that is beyond the acceptable amount in order to use the TheraSuit. We do still encourage these children to do the intensive therapy program because they are still getting 3 hours of therapy every day for 10 and 15 days, which those children also make significant gains over that time. So even though they're unable to use the TheraSuit, we may use a Theratog, or we may just do the program without using the TheraSuit. And I try to explain to the parents the TheraSuit is a tool, just like any other piece of equipment that we may use with these children. And some children are appropriate to use that TheraSuit, and others it's not appropriate to use with them. I'm very fortunate that I found something that I love to do and I enjoy doing. And when I see these kids being able to attain skills that have been so difficult and challenging for them, it's very rewarding. And when you see a parent and that their child walks to them for the first time and they're 10 years old, you know, it's very rewarding.